Welcome and thank you for taking the time to join me today. This presentation is designed to give you a comprehensive understanding of radial shockwave therapy, how it works, what it treats, and why it's a valuable addition to any clinical setting. Whether you're exploring this technology for the first time or looking to expand your treatment offerings, this session will help you make an informed decision. Section 1 of this presentation will provide you with a comprehensive introduction to radial shockwave therapy. Firstly, there will be an overview of shockwave therapy, including what shockwave therapy is, how it works, common conditions it is used to treat, the basic differences between radial and focused shockwave therapy, the benefits that introducing shockwave therapy can provide to your clinic and to the patients, and the potential risks and side effects of shockwave therapy. Section 1 then delves into the technical aspects related to how radial shockwave therapy works and the physiological responses it creates. The benefits of the treatment are then presented, along with how altering the treatment parameters achieves the desired therapeutic effect. Finally, Section 1 covers the important topic of what patients can expect from the treatment, providing you with information that will help how you discuss shockwave therapy with your patients and will contribute to the shared decision-making process. Section 2 has a greater clinical focus, covering the indications and contraindications for shockwave treatment, information related to patient selection and assessment, including a clinical reasoning framework that you can implement in your practice, treatment application techniques and safety considerations, and finally, information related to the evidence and clinical outcomes for the treatment. At different points during the presentation, there will be videos demonstrating the practical application of radial shockwave therapy, and there will be references to research throughout the presentation before a list of useful resources is provided at the end. Section 1, an introduction to shockwave therapy. What is shockwave therapy? An overview. Radial shockwave therapy is a non-invasive treatment that uses high-energy acoustic waves to stimulate healing in musculoskeletal conditions. It is part of the broader group of extracorporeal shockwave therapy methods, but specifically uses radial shockwaves rather than focused shockwaves. Shockwave therapy works by using a handheld device which generates pneumatic or electromagnetic pulses that produce pressure waves. Radial shockwave therapy generates pneumatic pulses, whereas focused shockwave devices produce electromagnetic pulses. These waves are transmitted into the skin and spread outward into the affected tissue. The waves are reported to increase blood flow, stimulate cellular repair, break down calcifications, and reduce pain through effects on nerve endings, all of which will be discussed in greater detail later in this presentation. Shockwave therapy is commonly used to treat chronic tendon and muscle conditions such as plantar fasciopathy, Achilles tendinopathy, tennis elbow, shoulder calcific tendinitis and rotator cuff related pain, patella tendinopathy, and sometimes for myofascial pain. There are two distinct types of shockwave therapy used by clinicians. They are radial and focused shockwaves. As already mentioned, radial shockwave therapy generates pneumatic pulses, which are mechanical sound waves, not electrical, and these disperse energy over a wider, more superficial area. They're shallower and lower energy compared to focused shockwaves, making them ideal for treating superficial soft tissue conditions. Focused shockwaves concentrate energy deeper in a precise point by creating electromagnetic pulses, and it is used for treating deeper tissues, such as those close to bone, along with delayed unions and non-unions. Introducing shockwave therapy into your clinic can have a number of benefits for the clinic, and most importantly for your patients. The physiological response to radial shockwave therapy and the benefits of treatment are discussed in greater detail later in this presentation. However, in short, shockwave therapy is a low-risk, non-invasive treatment which does not require any anesthesia prior to administration. As it is non-invasive, there is no risk of infection. The application of the treatment is quick. It takes approximately 5 minutes, therefore can easily be completed during the duration of an appointment without the need to allocate longer appointment sessions. The treatment has been shown to accelerate healing in chronic conditions that haven't responded to other conservative treatments, and its use has been approved in a variety of conditions by the National Institute for Health and Care Excellence, with NICE guidance allowing routine use in plan to heal pain dating back to 2009. Like all treatment modalities, there are a list of indications and contraindications for the use of radial shockwave therapy. But briefly, some of the risks and side effects of using the treatment include mild pain, temporary redness, swelling, or bruising. And of course, it is not going to be suitable for everyone, so is generally avoided over open growth plates, near tumours, during pregnancy, or over certain vascular and nerve conditions, all of which is covered in the indications and contraindications for shockwave therapy section during section 2 of this presentation. So from that initial overview of radial shockwave therapy, we can appreciate that it is a quick, relatively low risk, non-invasive treatment modality that helps the body heal by producing acoustic waves that produce biological effects in the targeted tissue. When compared to focused shockwave therapy, radial shockwaves are broad, superficial, and of lower intensity. Therefore, radial shockwave therapy is indicated for the treatment of soft tissue and tendons near the surface. Thank you for your attention. If you are considering adding shockwave therapy to your clinic, please get in touch with the team at Eureka, who will be happy to discuss device options and implementation strategies.